Good morning, I'm Kim Nelson and this is Nursing Skills 2 NG Tube Insertion. There are many reasons to insert a tube. I'm just going to move this over. Gastric lavage, you can feed through the tube, you can decompress the stomach or empty the contents prior to surgery. It is a clean procedure, it's not a sterile procedure, so you want to obtain good hand hygiene, washing your hands and wearing gloves. Introduce yourself to the patient and explain the procedure. I have with me a Salem valve, basically stop reflux. It's an anti-reflux valve. I have a 10 French nasal cannula, a glass of water with a straw, and I have a 60 cc syringe. So what we're going to do is we're going to measure how far the tube needs to go in, and to do that you go from the nose to the earlobe and then down to the xiphoid process, all in one continuous. You can mark that area with a piece of tape. You're going to want to lube the end of your tube, just like so. Have the patient in a semi-Fowler's position or seated up at 30 degrees or so. Have the patient looking straight forward. We're going to introduce the tube about 3 inches to 4 inches in there, hopefully just before he gags. And then you're going to have the patient tilt their head forward. You're going to offer a glass of water and have them swallow. As they're swallowing, you insert the tube each time they swallow right up to the tape or until it stops. So once you get that done, I'm just going to take this piece of tape off. Do not let go of the tube. You're going to want to secure it for just a little bit. If you're having problems or the patient is gagging quite a bit, you may want to look inside his mouth and make sure that the tube is not curling up inside the mouth. Let me just do this quick secure. Okay. So now we need to check for placement. I'm going to put the valve on the end here, and then I'm going to want to kind of keep this clamped so that none of the gastric juices come back at me. Using the stethoscope and on the fundus of the stomach, listening on the fundus of the stomach. You're going to want to put in 5 to 10 cc's of air right in here. Okay, and then you want to listen while you push the air in. If you hear a whoosh, then you know that you're in the stomach. Now another way to test this is to withdraw 5 to 10 cc's of stomach contents. Just plug that for a minute. And then you can check it with a pH strip. And if it's 4 or under on the pH scale, then you know you're in the stomach. Okay, so at this point we're going to take this piece here, the end piece, and we're going to hook it up to suction, just like so, and turn your suction on. Now something that may happen with the tube is it will get stuck against the wall of the stomach. At that point you can take a clean syringe, 10 cc's of air, up to 10 cc's of air, take off your reflux valve. This is the only time you would put air into the blue tube. Just give it a quick push, and that'll just push it right off the end of the stomach. Put the valve back on there. You're hooked up to suction. Ask the patient if he's feeling okay. Make sure you tape this securely, just like so. You can document all that you've done, the size you've used, how many centimeters you are in, what speed you have your suction on. Wash your hands. Make sure the bed is in the lowest position, and make sure that the call light is turned on, or that he has the call light. You can also take a piece of tape and put it around your tube, just like so. And then take this and tape it to his gown, making sure he has enough room so that he can move his head side to side. And then that gives him a little bit more freedom without causing any pressure on that part, which is the nose. Okay, prior to insertion, you want to make sure you select the best nair, making sure, looking for polyps or septal deviation. Sometimes there's an nair that's bigger than the others. Try the larger nair first if you can. Go a little bit easier. At this point, we are done with NG tube insertion.